What was the diagnosis of your condition?
Okay, my condition started when I was very young. Unlike a lot of people that have orthopedic problems when they're older, I started about age 8 with my symptoms, and so they did see that my left hip, only my right hip was fine, but my left hip that was deformed. And I went to a children's hospital in Minneapolis. So they said it was called Legg-Perthes, and it's not as uncommon as you think. A lot of people, it's kind of rare, but it is around. I actually know other people that have had this. But my first surgery was in 1970 at a children's hospital in Minneapolis. And what they did, they stopped the growth because they really didn't know what to do. I'm too young. I was still growing, and so their decision was to stop the growth. They scraped the growth plate on the ball part. So anyway, my left leg consequently was shorter than my good leg, and so at age 12 I went back to the same hospital in Minneapolis, and they did a surgery on a perfectly good, healthy knee to stop the growth of my right leg, so I wouldn't have two really uneven legs, because it already was starting to be uneven. So I was walking with a limp, but I do remember I couldn't move my left hip as well as like my friends. I didn't have the flexibility. I just couldn't walk as long. But in my early 20s is when I started noticing problems, and it was when I was a college student in Minnesota, and so I really needed to have something done. I could tell the pain was getting worse and worse and worse. So it was bone on bone wear at that time. So I said, okay, let's do this. By the time I just had turned 25, I had my surgery scheduled with this leading orthopedic surgeon in Minnesota, and he did I was one of the first patients to have the non-cemented porous ingrowth, total hip replacement, the whole thing. And at that time, you were in the hospital for 10 days. It was 6 months, no weight bearing, absolutely no weight. They just really, because it was so pioneering at the time. So at any rate, it did take the pain away, and I was really happy. I was walking, and I could walk pretty long distances without any pain.
Nice.
The pain before the surgery was unbelievable. It kept me up at night. It just made me grumpy. It changed my personality. I just got married at the time, and I just was not myself. And I was living on anti-inflammatories. And I could just tell when they were wearing off. It was like, please give me another one. It was just one after another. So anyway, I was off the anti-inflammatories, and life was really good. I finished my college degree in health science and became a dental hygienist. So, and living in Minnesota, having a hip replacement, I was worried about falling on the ice. So after a few winters in Minnesota, just worrying about falling and injuring my new hip, we moved to Washington because my husband's family lived out here. So I needed to find an orthopedic surgeon. So that's when I had a friend that told me about Dr. Barrett. So when I first met Dr. Barrett in the early 1990s, I just was wowed. I just connected with him right away. He listened to me, he listened to my concerns. He felt very confident that, if there was something down the road that he could deal with it, and he gave me hope. So my first surgery was with Dr. Barrett in 1993, where he went in and he was trying to be as conservative as possible, and I really followed his suggestions and recommendations. So he changed out the liner, and he cleaned it out and put in new bone grafts, which really helped me. And I took to it right away. I had no problems whatsoever. It was a bit of a recovery, not as long as like the first initial hip replacement that I had, the full replacement.
Mm-hmm.
So what he did was a partial revision, so to speak, giving me more time, being conservative at the surgery that he did.
Mm-hmm.
So then time went on again. I'm using my hip, and since this is 1985 technology in me,
Yes.
he consulted again with my other orthopedic surgeon in Minnesota and some other orthopedic surgeons what to do with my case, since I'm young, and what should we do? He didn't want to be real aggressive. So in 1998, after my yearly exams, and you could see wear again on the liner because it's not right in the center, it started to move down.
Mm-hmm.
So after his consultations with other orthopedic surgeons, and he decided, well, he'll go in there and change out that liner again. So it's kind of like changing the brakes on a car.
Right.
And he was again trying to be very conservative, knowing that I was young.
Mm-hmm.
So, but he was able to follow my symptoms. I really wasn't having any symptoms. 2008, I was starting to feel a little bit like it's kind of wearing, and he could see the wear. And he again consulted with my orthopedic surgeon in Minnesota what to do. He said, just let's wait until she really has some, say, significant symptoms. Trying to literally squeeze out and prolong any surgery, since I've already had at this time 4 on my left hip. But in February of 2008, I was putting my sock on and I heard this snap sound, and it was my left hip. Definitely was my left hip, and it was. I felt like it was a crack, and that's definitely what happened. So we knew what I definitely got as much wear as I could out of my hip. So I went to see Dr. Barrett, and he said, we knew this day was coming, and he knew I had to bite the bullet and have everything taken out and have it redone. So Dr. Barrett gave me great hope that this was all going to work out just fine, and he was totally confident he could work on this huge challenge of my left hip, of getting the old parts out and trying to prepare my hip for a brand new one. So that's about as challenging as it gets for an orthopedic surgeon. But he was completely confident and showed just like I shouldn't have to worry, even though I really was, because this was number 5 surgery. And so we had that scheduled, and it all went beautifully. I anticipated that I was going to continue with limping, and I was going to have some pain, some level of pain, some level of problems, because I've had so many surgeries. His hips pretty much have seen the limit of how much he can have done to it. Mm-hmm. But Dr. Barrett gave me no worries. Every time I'd see him, even though I was really anxious, in fact, the day of the surgery, as soon as I saw him, he came in right before my surgery, I was like, he just calms me down. So, and I know I'm in the absolute best hands possible with his judgment, and he was prepared for everything that could happen and before, so that in the surgery he was ready to go. The whole team, from his physician's assistant to medical assistant, was just, the whole experience was phenomenal. So I can't even compare this latest surgery to my previous one.
Really?
Because it was
So different.
completely positive from start to finish. The preparation, the surgery, the follow-up visits, everything.
So how are you today? I mean, how are you walking? Do you have full, complete movement?
So prior to this last surgery, my legs were uneven, and I had to put lifts in my shoes,
Mm-hmm.
all my shoes,
Mm-hmm.
and I definitely had a limp. Apparently, the first hip replacement wasn't in the optimal position,
Mm-hmm.
but they did what they could back in 1985 at the time in the technology. When I look back, my pain was never completely gone.
Mm-hmm.
I always had a little bit of a dull ache, but it was much better than what I had. But when I woke up from surgery, and I'm just kind of used to having surgeries, I looked down, and for the first time in my entire life, my two knees were lined up even, and I was like, that is a miracle. One was always shorter, and I said, I can't believe it. I can tell right away. I think my legs are even. When I was able to put full weight on it, because I couldn't put full weight on right away. I had to wait for the bone to take hold and the bone grafts to set, and just everything to be more secure in there. And I completely followed Dr. Barrett's advice and recommendations. I was not going to stray from anything that he didn't, if he recommended something, I was going to do it. So when I stood up for that first time able to put the full weight on, I knew my legs were even for the first time in my entire life. So I had the lift in my shoe, and I had to take it out, and I was just very emotional. I was just amazed.
That's fantastic.
So the things that I most note after this surgery, and that has really been a significant improvement, is not only are my legs even, and I've been able to take out all my lifts in my shoes, but when I put my pants on, they completely are symmetrical. My hips are.
Nice.
My left hip used to be sunken in, and now they are matching my other good hip. And also my limp, my very significant limp that I've had my whole life, and it was pretty bad when I was growing up. I think I just adjusted to it, never even knew that I had a really limp. But after some physical therapy, my therapist helped me get rid of that. I have absolutely no limp whatsoever for the first time in my life, and I'm 53 years old.
Wow.
So very significant changes and improvements in that realm. So.
That's awesome.
The miracle.
The miracle.
Okay.
Yeah, let's talk about that.
But basically, what he had to do, and it was very drastic, and it was such a significant surgery. But the end result was that, to me, it really is a miracle how well it turned out. And I never knew it was going to be this good. I would say don't wait, because the technology is there now. And if you wait too long for the pain to set in, you can really start living your life now and be free of the pain and have a great quality of life. And that's what I'm living now. My quality of life is just amazing. So I never knew that it was going to be this good. I can walk probably 4 miles now, and I have no achiness or discomfort whatsoever. And so it's just amazing.
Great. Okay. Thank you.